I'm going to ventilatory management my adult patient. BSI, see and safe.
See and safe.
I'm going to open my patient's airway using the head tilt chin lift, considering that there's no trauma. I am going to insert an oral airway, measuring from the corner of the mouth to the tip of the ear.
No gag reflex is present and the patient accepts the adjunct.
I am going to ventilate my patient using a vague valve mask. One breath every 5 to 6 seconds, watching for chest rise and fall.
Ventilation is being performed without difficulty, and pulse oximetry indicates the patient's blood oxygen saturation is 85%.
Okay, I'm going to go ahead and hook my patient's vague valve up to oxygen at 15 liters. And I'm going to bag 10 to 12 times per minute. One breath every 5 to 6 seconds. Again, watching for chest rise and fall.
Breath sounds are present, equal bilaterally, and medical direction has ordered an intubation.
Okay, I am going to have my partner take over, bagging the patient and pre-oxygenating them while I set up my equipment. I am going to choose my tube, which is an 8O. I am going to test my cuff, putting in 10 liters, 10 mLs, making sure that everything is okay. I am going to insert my bougie into my cuff, making sure that it does not, or into my tube, making sure it does not go past the eye. I am going to inspect my blade. I'm using a number 3 Mac, checking the light and making sure that everything is secure. Okay, I'm going to go ahead and direct my partner to stop bagging and remove my oral pharyngeal airway while I intubate my patient. Ready? Open the airway using the scissor method. I'm going to go in. Go in to the glottic opening and down the glottis, just past the vocal cords. Going to remove my blade, remove my bougie, inflate my cuff, remove my syringe, and we are going to bag. Everything's been done, and we're ventilating. We've confirmed proper placement. I'm going to listen over each lung and over the epigastrum, making sure that it is correctly placed.
If you had proper placement, what should you expect to hear?
I'm going to hear equal breath sounds over the lungs and nothing in the epigastrum. I am then going to secure my tube either with tape or a commercial device.
Please demonstrate one additional method of verifying proper tube placement in this patient.
Okay, I am going to attach a CO2. I am going to plug this into the monitor, zeroing it out. I'm going to have my partner stop bagging momentarily. We're going to place that on there. We're going to go ahead and put this back on and begin bagging again at 10 to 12, watching the monitor, checking to make sure that we're between 35 and 45.
You see secretions in the tube and hear gurgling sounds with the patient's exhalation.
Okay, we need to go ahead and suction. So I'm going to get my suction tube. I am going to measure from the corner of the mouth, around the ear. Corner of the mouth to around the ear to the notch of Louis, and using my forefinger, I'm going to mark my spot. I'm going to have my partner stop bagging. And I'm going to go into the tube, not suctioning on the way in, down to where I have marked it, and then I am going to suction on the way out. I'm going to then have my partner begin ventilating again at 10 to 12, and I am going to rinse off this with normal saline and prepare it for next use if need be. Done.